COVID cases are exploding in Florida. Not really. At least if you're listening to the media, you would imagine that. A lot of times we hear news articles related to what's going on in Florida. And I hear it all the time, even here in New York, where people are like, I can't believe Florida's wide open. What's going on over there?
You haven't noticed. The white people are melting out here.
It says here, uptick in Central Florida coronavirus hospitalizations continue as states reports 255 new patients. Florida Department of Health reports 139 new deaths. And of course, this is, causing panic. As candidates prepare to outline their pandemic responses, Florida reports 2,582 new cases, right? Talking about here, it says the Florida Governor De Santis has moved forward with opening the state's economy, and the last two counties hardest hit by the pandemic are giving the option for students to return to in-person learning. Florida continues to see thousands of new cases of the virus. The Florida Department of Health said on Wednesday that there are over 700,000 people tested positive for COVID since the virus was first detected back in March. In terms of deaths, they've had 15,000 deaths. Now, you might be thinking, that's a lot, depending upon the population. Of course, if you're looking at the population numbers, you would see not really a lot of people by comparison to, of course, the number of people that have lived there. And talking about hospitalizations, it says, though cases count have been on the decline, right? It's more important to gauge how people have been hospitalized due to the virus to see how the illness is impacting communities. The state reported 255 new hospitalizations just on Wednesday, meaning the state that has seen a total of 45,000 patients admitted into the hospital since March, January, March, April, May, June, July, August, September, October. So in 8 months, you've had 45,000 patients. Seems like a lot. Let's see. There's currently, there are 2,000 patients. There are 2,124 people hospitalized in Florida with the virus, according to the state, of course, health agency. Now, some people might think that this is cause for alarm, but again, in comparison to the number of hospital beds that they have out in Florida, in comparison to the number of patients that are who have beds that are dedicated to the virus, it's actually quite small. It's actually under 3%, right? So what do you think the Surgeon General is going to do out in Florida? He's going to tell people, stop bullshitting. Why? Because that's exactly what's going on. Florida Surgeon General, and this of course is from October 21st. Florida Surgeon General says that he's going to implement additional review process for fatalities attributed to COVID-19 to ensure data integrity. Why is that? Well, it goes on to say that of the 95 fatalities that were reported in Florida to the Department of Health today, 11 of them were 30 days old. 16 had at least 2 months between the time the individual tested positive and the time that the individual passed away. So there's a lot of room for things to go wrong during that patient's stay. It's also important to understand age, which we actually get to see, whether they were male or female, etc. Right? Talking about the date that the person became a case, it says DOH made aware of the case, right? You can see right here, the person back in June tested positive, but the person didn't die until the end of September. So we're seeing over 3 months, right? Over 3 months between the time that the person actually died. 5 had at least 3 months between the time that the individual tested positive and the time that the individual passed away. And so unlike what we see in New York, where we get that much information, right? You get this much information and it's wear a mask, we're shutting everything down, wrangle up the Jews, etc. But at the very least, coming out of Florida, we get quite a bit more information, right? So as you can see, you can take a look at the ages, right? 85, 87, 74, 73, 76. Some of them, there were some that were 58, 61, but for the most part, you'll come across and you'll see 93, 94, 73, 86, 91, 76, 95, 79, 79, 89, 66, right? Most of these people, as you can see, going down the list, you can see all these ages here, right? Looking at all these ages, most of these people are at the very least, for the most part, over 70 years old, with a good amount of them being between the ages of 80 and 90. The average life expectancy in America for men and women is around 70 something years old. So I think it's like 73 for men and 77 for women. So many of these individuals are well past life expectancy. And so, of course, the Surgeon General is realizing that you're cooking the books. I know that you're saying that a lot of these individuals have, of course, tested positive, but there's a lot of information that, of course, that is missing from the data. And of course, as it goes on to say, there's some very good information coming out. It says today the Florida Surgeon General announced Department of Health will conduct more thorough reviews of all facilities, of course, that are reporting. It says the facilities data reported to the state presents confusion and warrants a more rigorous review. As Florida Surgeon General says, during a pandemic, the public must be able to rely on accurate public health data to make informed decisions. To ensure the accuracy of the data related, of course, to deaths, the department will be performing additional reviews of all deaths. Timely and accurate data remains the top priority of the Department of Health. And I would love if we were actually to have that here in New York. There's a lot of information that is not given to individuals of the public. All you hear about is cases and fear and crackdown. That's it. That's all that we get over here in New York. At the very least, of course, surprise, surprise, it is in a Republican state. We're seeing a more scientific and, of course, logical way of doing things. Cases, I should say cases, because positive PCR swabs do not represent cases. Cases are when individuals go into the hospital, seek medical treatment, and a case is opened, right? There's a medical MRN number that is given to that individual when they come into the hospitalization seeking treatment, right? And of course, for many of these individuals who are just going routinely to these different sites to get swabbed, it's a completely different story. There's no case being opened. They're not seeking medical treatment. They're just randomly going to get tested because this is what people want, because they're fearful. And this is what has been perpetuated within the state, this level of fear where people are just randomly getting tested, showing no symptoms, but of course they're worried and want to get tested on a regular basis. And this is what happens. And it's really good to see. Like I said, at the very least, we're seeing a little bit of logic, a more scientific, mathematical way of understanding. Are we really seeing cases, or is a lot of this just false noise that is in the data that is misrepresenting the seriousness of what's going on within the healthcare system, what's going on so that the people can make, as he said, an informed decision. Here in New York, many are not given an informed decision. Do you want to go out and riot and you want to put your fist up and complain about the police? Sure, no problem. You want to go out there and you want to talk about, trans lives matter en masse and tens of thousands of people? Sure, no problem. Do you want to march on Washington for abortion? Sure, no problem. Are you a Jewish person who wants to go to church because you want to celebrate the holiday? We can't have that, right? Why? Virus. And this is what I talk about. What we often see, especially here, is a misrepresentation of what's really going on. And I wish more people would wake up and push back.